We all know it is a very frustrating, embarrassing problem women will face. What is urinary incontinence? Urinary incontinence is if there is involuntary leakage, means it is not under your control. You want to stop leaking the urine, but you are unable to do so. And if the urine leaks without your control, then we call it urinary incontinence. And is it common? If someone asks, do women face this routinely, very rarely? Means it is common than what is reported. Then what we know is the problem. So the problem is more than what we think it is. Almost 30 to 40% of women at some point in their life can feel the problem of urinary incontinence. Whether it is temporary or long, it is still a concern. So let us see what are the types of urinary incontinence, how we are going to deal with it, what are the treatment options that are available. So what are the types? Means is it incontinence? Means is it same for all? Means it is not. There are so many types of urinary incontinence. Layout is called stress urinary incontinence. Means what is stress? It is not the mental stress. It is not even the physical stress on the body. It is the stress on the bladder. What causes stress on the bladder? When we cough or sneeze or laugh loudly or bend suddenly, there is a pressure on the bladder, and that stress is called stress urinary incontinence. And when there is pressure on the bladder and urinary leaks, along with that pressure, it is called stress urinary incontinence. So when you have a leakage of urine, when you cough, sneeze, laugh, bend, or whatever, like too much of activity, sudden waking up. So this activity is enough for you to cause urinary leak. Then you have a problem called stress urinary incontinence. What are the other types? Is it the only time that people leak urine? There are other times people can leak urine. Sometimes there is what is called urge incontinence, means when there is a sudden sensation that yes, you need to pass urine, but you are not going to make it to the toilet. Meanwhile, by the time you reach the toilet, there is a leakage of urine. That is called urge urinary incontinence. Sometimes we can also associate this with other things like frequency. You all the time go and pass urine and come back 10 times, 15 times, 20 times in the day, or even more. So if you are going so many times, we call it as frequency. And you have to get up more than 1, 2, 3 times in the night. Then also it's called nocturia, means you are going too many times. All this can be associated with what is called the bladder being very oversensitive or overactive. Then you can lead to the urge urinary incontinence. Sometimes there can be a mixture like this and that together, a stress urinary incontinence or urge incontinence, all put together. We cannot differentiate you have this as more or that as more. So people can have both, a component of each. Sometimes there can be a very different type of incontinence. Means people, like some women, will not be able to pass urine completely. So when there is some urine retained inside the bladder and it goes on increasing and increasing, when you go and pass urine, it's only small quantities and rest all remains inside. And then when there is a full bladder and when you're trying to go and walk or do something, that fullness of bladder, it cannot hold on for a long time and there is incontinence or leakage of urine. That is called overflow, means already full bladder and it over like leaks over and above that capacity of the bladder, and that is a different problem. It cannot be dealt in the same way as the overactive bladder or urgency. So it has to be dealt in a completely different way. And sometimes there is a constant urine leak, there is absolutely no stoppage. There can be fistulas, means opening between bladder and vagina, or ureter and vagina, uterus and vagina, and bladder. All this can be a constant flow of urine. You cannot hold at all. So that is called like a complete total urinary incontinence. So when do you think, okay, what type of incontinence I have? When should I go to the doctor? So if you have a concern that you are leaking urine without your control at any point of time, and that is happening maybe where it is embarrassing to you most of the times, or that is affecting your quality. That means with this problem, because you have the leak, you're not able to go for social activities, you're compromising few things that you are not comfortable with, then that is the time you have to approach a doctor to find solutions what you can do about it. And sometimes even if some women are old, frail, debilitated, they won't step out of the house, but still if you ask me, should they also consider coming and seeing a doctor, I will say yes, if they have skin problems. Because if there's urine constantly at the vaginal area, vulvar area, it can cause some problems for some women. Or sometimes some women will use so much of like sanitary napkins that can cause rashes, irritation of the skin, breakage, ulcers, swellings, all these things. So they can also have problems. So anyone who has a urinary incontinence can approach the doctor and find out what type of incontinence they have and what they can do about it. So what can be done? Like, what are the things that we can do even before we have a problem, or early on, even before you go and see a doctor? Let us look at few things. Sometimes the urgency is because of some irritants of the bladder that we don't know what is causing the irritation. So some irritants can be as simple things that you do every day, like as soon as you get up, you have a cup of coffee or a tea. That itself is enough to irritate the bladder. So strong, spicy food that some people will take it many times, or routinely if they are very used to all this, but still that can cause irritation of the bladder. So coffee, tea, or in fact even green tea, anything that has caffeine in it, fizzy drinks like colas and things that might also have caffeine in it. All these can irritate bladder. Too much of spicy food, too much of vitamin C, that is too much of citrus. So the moment there is any urinary problem, whatever it is, urinary infection or anything, first thing they talk, take lemon juice, too much lime or orange in too much of quantities every day. That may also cause some irritation to the bladder. So try and avoid. The most important things in the recent environment is many people are getting used to alcohol, smoking. So it used to be only common in men, but nowadays it is common in men and women. So these are also very strong irritants to the bladder. So if someone asks me, okay, you're telling only ones to avoid, what can I bring or what can I eat? Yes, non-spicy foods and water, plain water, milk, watermelon, apple. Be careful when you have diabetes. Sometimes the diabetes, too much of sugar contents can also irritate the bladder. So getting the diabetic control is also very important. So you can get the good sugar control and avoid irritation to the bladder. So by avoiding all these irritants, sometimes it can be helpful to reduce the urgency, to reduce the number of times you go to the toilet. And for stress urinary incontinence means, if there is a pressure, like if you are coughing and you are leaking, can we do anything? We call it as pelvic floor exercises. There is another name for it called Kegels exercises. That means if you have to pass urine, you control if you are not in an appropriate place and time. And you do it by squeezing the muscles of the pelvic floor, which is in and around the place where you pass urine. So you just squeeze them into your tummy and release. So if you don't know how to do it, what we explain is when you are passing urine, try to stop and see. So when you stop and say exactly the same movement, you have to do it in other times, not all the time when you are passing urine. If you do all the time when you're passing urine, trying to stop passing urine, that causes disturbance of to the brain signals, to the bladder. It's passing and you're stopping. So it is not good in the long run. You have So other times when you're doing something, when you're sitting, standing, cooking, any time, or you don't have to take time out to do these exercises. All you have to do is just remember to do them, concentrate, squeeze and release. Like that, how many times you have to do? 8 to 10 times at a time and 3 times a day. Morning, afternoon, night. So you can easily remember every time when I have lunch or dinner and breakfast, I can do these exercises. As I'm talking, we can still do the pelvic floor exercises. So you don't have to, take off your time to do these exercises. So remember to do it and do it. So how long do we have to do it to see the difference? If you start to have a problem or even before, then if you keep on doing the exercises, within 3 months, we can notice that almost two-thirds of women will feel that difference, they see improvement, and they feel that they will not require further treatment for that particular problem. So always when you have stress urinary incontinence, doctor will also tell you to do the pelvic floor exercises. If going before, like even before going to doctor, you can start to do this pelvic floor exercises. Sometimes they are not confident to do the exercises, or when we check that when they do the exercise, it's not strong enough. At that time, we take the help of physiotherapists, who are the doctors who are specialized in guiding these exercises to the women. So under their guidance, if you do the exercises, there can be difference. So till we know that there is the exercises are done properly, we cannot go to the next step. I think that's a very important first step. And for other things like prevent or to reduce the problem, if you are overweight, try to concentrate and reduce the weight. So come to an ideal, appropriate weight for your height. That can lead to a lot of problems. The pressure as such will be more on your bladder if the weight on your tummy is more. So reduce your weight, avoid all the irritants of the bladder, smoking, alcohol, and these are, I think, your general health will improve. And let us now see what we will do. When you come, have already done the exercises, and then if you ask what are the options now, I'm still having a problem. When I cough or sneeze or bend too much, I am still having problem with urinary leak. If urinary incontinence is purely stress urinary incontinence, it's only in the particular moments you are getting, and there is no improvement or very slight improvement after physiotherapy or pelvic floor exercise, and you still are bothered with it, then we go for the next options. We can use a surgery, because medications are not very effective for this particular problem. For this particular type of urinary incontinence, the medicines will have more side effects, so they are not recommended. Surgery is the next step. What is surgery? Should I be concerned about getting a surgery? The surgery is called mid-sling surgery. Means middle of the urethra, where that is a tube that connects to from bladder to outside. It is small. In women, it's around 4 centimeters. So somewhere in the middle, because we think there is change or disruption either during pregnancy or childbirth or after menopause, there is no hormone support, you are at higher risk of these changes in the pelvic floor, and it can lead to stress urinary incontinence. So how to support this? Supporting is by means of either doing the pelvic floor exercises or the next step going for surgery. So it's like a sling. We take either the same tissue from the woman, like a sheath, or we can use a synthetic mesh. There has been a lot of resistance for using the synthetic meshes recently, and there are few concerns for some women who had these meshes. So that's why it is important, if you are needing a mesh, take time and sit with the doctor and assess your problem and the risks, and then take the decision. And it's a permanent mesh that is inside the vagina. A small cut, it's a day surgery. You come in the morning, get the procedure done, and you can go home. If the tape is too tight, then you will not be able to pass urine. If it's too loose, it's not going to serve the job. So you have to get that in the right way. Most women will tolerate this procedure very well, and almost satisfaction rates after this procedure is also quite high. Almost 85 to 90% of women will feel better after this surgery. But we have to evaluate, is this surgery going to be good for you or not? Sometimes when there is an overlap of symptoms, there is a bit of urgency and some stress urinary incontinence, then we have to be very careful before we give this surgery to you. We have to then evaluate which component of your urinary incontinence is predominant and treat it appropriately. So, sometimes we might have to use some special tests. We check for urinary infection. We also do some urine flow studies. That means we ask you in a special come out to pass urine and see what is the rate of flow. Is there any urine that is left after you pass urine? Is there still something inside the bladder? And sometimes we use special catheters and measure some pressures inside the bladder, in your tummy, and then determine what exact type of incontinence you have and what to do about it. Sometimes this gives that excess information, extra information, so we can do the decision wisely and appropriately for you. And if your problem is not just stress urinary incontinence, you have an overlap of urgency. That first we talk about urge incontinence. Then first we need to assess that and see whether with the modification of drinks in your everyday life, can we do some change or not. We might ask you to fill in what is called as frequency volume chart. Means how many times you are drinking, what you are drinking, how much you are drinking. We have to make a note of it. And when you are passing urine, how many times you are going, what time are you going, how much you are passing. You have to measure each time when you pass urine. That we will ask you only for 3 days, sometimes 5 days and 7 days, but most of the time we get adequate information, at least if you fill for 3 days. And when we see is there something that we can avoid, we will tell you. If it's all okay, then we might suggest some medications. For this particular type of incontinence called urge incontinence, there are medications that are useful. So there is no surgery for urgency incontinence, but medications are the first and foremost. Sometimes these medications can have some reactions, like there are side effects like constipation or like feeling all the time thirsty, dry mouth, nausea, like that. So we always give the medicines in the smallest dose possible, and we can increase if you are tolerating the medicine well. So if your problem is mainly the daytime, then we concentrate giving medicines in the day. If your main problem is in the night time, we do in the night. But if you have too much bother with some side effect for a particular medicine, we will try and change that medicines also. We have options here. We have 2 3 different types of medicines that we can work on. But the moment you start medicine, we will not have the effect immediately. You might have to wait for 2 3 weeks to see whether that makes a difference or not. So when we start a medicine, we ask you to come back after 3 to 4 weeks, and then we will see whether you are able to tolerate the medicine, whether that is effective, is this dose okay, or do we have to increase or tweak a little more. All this can be assessed. And once that urgency problem settles, and then you realize only the stress urinary incontinence is more, that means only when you cough and sneeze the problem is there, we can then go for surgery. If your problem is only overactive bladder, this might suffice. Sometimes if it's only your overactive bladder but medicines are not effective, we have tried 2 3 types of medicines and still it is not effective, then we also have options of putting some injections called Botox injections into the bladder. We instill that into the bladder. But this also have a side effect. You might have retention of urine, means you will not be able to pass urine after that sometimes. So that's why we always teach how to put the catheter yourself if you were to have this problem. But it is very good in treating overactive bladder, but the efficacy is not long time. It's always after 6 months or 7 months, the effect will wear off, and you might have to get this repeatedly. So if it is to an extent that it is intolerable, then there are few other things like using intestine to extend the bladder capacity. We call it as cystoplasty. Complete urine diversions. It's like you cannot take it. These are also, there are advanced methods that are available. So these are reserved only for very, very specialized centers. There are some stimulation things like sacral nerve stimulation. We can attempt so many treatment options if overactive bladder is the problem. What if you have overflow incontinence? You are not able to empty the bladder completely, and so you are having a leak. Then we teach you how to put the catheter yourself. Means it's a small tube. It's called a catheter. You can pass through the urethra. You might have to use a mirror. Sometimes some people who have arthritis will not be able to do. They might need some help to put the catheters. Putting a catheter and leaving for a long time is not the best option, because that will have other inherent problems with increasing urinary infections that can have later problems. So teaching or having an assistant or a nurse or a person who gets trained might be an option for some. For few women, overactivity or any urinary incontinence can increase the risk of fall. The moment you have urgency in the night, they have to get up fast, and while moving fast, old women sometimes can have a fall and suffer injury. So we have to be very careful, and that is the reason first when I said all women with urinary incontinence better to consult the doctor, because it might be okay for some occasions for somebody but not for long run. So always getting help is very much advised. And now with so much of varied options, I'm sure people can find benefit at some point or the other. And if we are completely out of our whatever options and nothing suits, because medically you can't take medicines or whatever, we still at least can offer some relief of options, like how to deal with life when you have so much of incontinence. For example, instead of using sanitary pads, we can offer like diapers or a nappy, like how babies will have nappies. So women, older women can use the diapers. They are more absorbent and less likely to cause skin irritation. So sometimes people will say, okay, sanitary pads are cheaper, but always we advise, because of the irritation, they're not meant for absorption of the urine. So you can have that skin problems coming. So always use diapers, or sometimes handheld urinals. Wherever you go, there's one handheld urinal thing, so where you can just pass urine. These are also the methods we can offer, like for the women who cannot go to the toilet, we will try and adjust or make some changes, so they can have a toilet just adjust into the bed, so they don't have to go fast and have a fall and have more problems. So all these can also be done if we are reaching to a point that, these are better for someone. So by knowing, realizing that we have options, and we also sometimes feel that, urinary incontinence is an aging thing, we can just have to put on with it. That is an absolute no. We have to have an awareness that it is not normal, and you can approach. So approach the doctor when you have a urinary incontinence. Hope we have answered few questions that are related to this topic. If you have further questions, please either text us or you can call us. Thank you.